Hello, my name is Agnel Monteiro. I'm a third year medical student and I'm going to do breast examination today.
Okay.
What's your name?
Mrs. Savita Monteiro.
Ask the patient to undress down to the waist behind the curtain and provide blanket to cover. Ask the patient to sit upright on the edge of the bed with the hands relaxed or on the thighs or on the sides. Ask the patient to uncover the breasts. Note any presence of the following: obvious masses, swelling, scars, skin changes, nipple changes, and asymmetry. Ask the patient to push her hands on her hips and push inwards. This is to tense the pectoralis major. Repeat the previous inspection. If a mass is noted, observe if the mass moves with the pectoralis muscle. This is known as tethering, which suggests malignancy. Next, ask the patient to place both hands behind her head or tell her to raise her arms above her head. Then repeat the same inspection. Inspect the breast tissue for any masses, asymmetry, dimpling, or puckering. Finally, ask the patient to lean forward, keeping her hands behind her head. Inspect the breast tissue for any masses, asymmetry, dimpling, or puckering. Ensure to warm hands first before touching the patient and examine the normal asymptomatic breast first. Position the patient on the bed either at a 45-degree angle or lying flat on the bed and ask patient to place her hand on the side being examined behind her head. Examination of the nipple. Squeeze the nipple gently to check for any discharge. Note the color, amount, odor, and consistency of the discharge. For the spiral method, use finger pads of the three fingers of one hand to compress the breast tissue against the chest wall and feel for any masses. Press downward using a circular motion or vertically if using vertical strip method. Apply steady pressure pushing down to the level of the chest. Apply enough pressure to palpate to 3 levels of depth, first superficial, then medium, then lastly deep to the level of chest wall. If a mass is palpated, describe it according to the following characteristics: position, shape and size, consistency, mobility, fluctuance and overlining skin changes. Examination of the axilla. Palpate the axilla with a free hand. Ensure to cover all areas of the axilla, the medial, lateral, anterior and posterior walls and even the apex of the axilla. And finally, we will perform a general lymph node examination of the following areas: the cervical, the supraclavicular, the infraclavicular, and the parasternal. After the examination, cover the patient with a blanket or sheet. Allow the patient to dress up, explain the findings to the patient, entertain and answer questions from the patient, and finally thank the patient for after the examination.